Hi, I'm Dr. Eric Balcavage. I want to thank you for requesting this DVD on peripheral neuropathy. I've been in private practice in Glen Mills, Pennsylvania since
I
1996.
consult with over 600 doctors around the country every week on chronic conditions like peripheral neuropathy. If you've requested this DVD on peripheral neuropathy, you or someone you love has been diagnosed with peripheral neuropathy, and you're either newly diagnosed and you're looking for a non-drug solution, or you've been diagnosed and had this condition for a long time and have struggled with the current traditional healthcare model. You've been through the medical merry-go-round, you've tried medication after medication with limited or no results, and for some of you, you may actually be feeling worse as the result of side effects of the medication. What I want you to know is that there are solutions for dealing with peripheral neuropathy. We deal with them on a regular basis, and in this video, I'm going to explain to you what my office does and the doctors I consult with all around the country are doing to help people with peripheral neuropathy end this nightmare. So one of the questions I'm often asked is, what makes my office different? What makes me different than one of the other 5, 10, or 15 doctors they've already been to? Because most people who get this are already frustrated. They already think, or they've already been told they have to live with it. And they're really interested in what makes us different. And the answer is really pretty easy. And that is, I treat you, not your diagnosis. Just because you've been given a name for the condition you have, it doesn't mean that your treatment needs to be the same as the next person that's diagnosed with peripheral neuropathy. Everybody has had different life experiences, and those life experiences have caused you to have the conditions that you currently have. And so your treatment and your needs may be different than the other person who has peripheral neuropathy. Let's face it, your family history is different. Your lifestyle's been different. Your food and nutrition isn't the same as the other person who has peripheral neuropathy. The drugs you've taken, the medications you've taken, all probably different. Your blood chemistry, probably different. And so it's insane to think that everybody who gets diagnosed with peripheral neuropathy should get the same treatment. It just doesn't make sense. Everything you've experienced in your life is different from the person who may have peripheral neuropathy that's sitting right next to you in a doctor's office. So your treatment needs to be not directed at the diagnosis. The treatment needs to be directed at you, the patient. And the only way you're going to be able to do that appropriately is to do all the appropriate tests to identify all the appropriate things that are wrong with you and start to correct those. And by doing that, making you a healthier person and correcting the problems that are wrong with you, that's how we get solutions, and that's how we get people better when they've failed everywhere else. You know, the problem in our society is we are great at diagnosing conditions and then treating the diagnosis or treating the symptom instead of looking for the underlying cause. This is what's creating the bulk of our healthcare problems, is we don't treat people appropriately. Let me give you an example of how this works in maybe a different scenario. My wife went down into our basement and noticed that the basement smelled. And she looked around and she came up from the basement and she said, you know, our basement stinks. She has now diagnosed our basement as stinky basement syndrome, similar to what happened with you. You had certain symptoms, you went to the doctor, and the doctor said you have neuropathy diagnosis. So what she did was she got some Lysol and sprayed the basement. That is similar to your doctor giving you a medication to suppress your symptoms. So half an hour after she sprays the basement, she goes back down and she's like, hey, the basement still stinks, I need to spray more. And that's similar to your medications. You take one, that doesn't do it, so you have to take some more. And we went through this for a few days where every couple hours she's downstairs spraying the basement to try and get rid of the odor. After a couple days of doing this, she decides, you know what, Lysol doesn't work, I need to get some Febreze. So she goes out, she buys Febreze, and she tries spraying Febreze. This is kind of like, hey, my first medication didn't work, so I'm going to try a different medication. So we do this for a few days. That doesn't work either. So then she tries plug-in stuff that she plugs into the wall, makes smelly stuff that just tried to mask the odor. We've tried candles. We tried doing a whole bunch of things. And after about a month or so of trying to do all this stuff, she determined that that was it. Nothing is going to work. We're just going to have this stinky basement. Kind of like what happens to patients who have tried multiple forms of treatment, medication. They're told, you know what, there's nothing else we can do. You're just going to have to live with it. However, there is something you can do, and that is to look for the cause. So what did I do? I went down and I started to look for the underlying cause of where the odor was coming from. What I determined is that there was a smell. It took me a couple hours to kind of pinpoint where the smell was coming from, and what I eventually found was that the smell was actually coming from outside the basement. The smell was coming from under our step, and that there was an animal that was kind of made residence underneath our step. So it wouldn't have made a difference how much smelly stuff she sprayed. It wasn't getting to the cause of the problem. So what did we do? We set some things in the environment so that the animal or the rodent would want to get out of there, and then we filled in the hole or the burrow, and over time, guess what? Within 2-3 days, the odor was gone, and we no longer had a smelly basement. Now, why did that work? Because we looked for the cause, and once we found the cause, we then got rid of the cause, and the odor went away. It would never have mattered how much stuff we smelled or sprayed, because it wouldn't have fixed the underlying cause. And this is what's happening with you with your neuropathy. If you've tried drugs, medications, and some treatments, they didn't get to the underlying cause or causes of what's creating your problem. We need to get to the bottom of that, and that's what we're going to do in my practice. The other thing that makes our practice unique is that we combine both metabolic and neurologic treatments. So what do I mean by that? Well, in the past, you've probably gone to different specialists and they've evaluated their little piece of the pie. In our practice, in our office, we evaluate the whole body. We evaluate all aspects that could be creating the neuropathy. So one of the first things we want to do is we want to look at your metabolic state, because we do know that the nervous system controls every cell, every organ, every function in your body. And if the nervous system doesn't work right, you don't work right. And so what does the brain need and the nervous system need to function appropriately? Well, it needs proper fuel, which comes in the form of properly regulated glucose and oxygen, and it needs activation. And activation comes from appropriate joint movement, muscle movement, and mobility. And so when those things work appropriately, you'll work appropriately. If you aren't working appropriately and you're suffering with neuropathy, then more than likely you're having a problem with either activation or with fuel delivery to the nervous system, and that's what's causing it to break down. So what are the things we look at when we start to look at your metabolic state? Well, right off the bat, one of the first things I want from every patient is I want to see a complete metabolic panel. And I know you may have had blood work done and somebody may have told you your blood work's normal. I want to do it anyway, and I want to see it anyway. So if you have blood work at home, the last 2-3 blood works you've had done, I want to see it, because I want to evaluate in a little tighter range than your lab levels of what's going on with you. As I said, the nervous system needs properly regulated glucose to function appropriately. So if you're hypoglycemic, reactive hypoglycemic, insulin resistant, or diabetic, you've got a blood sugar delivery problem, and we need to identify it, and we need to correct it. Sometimes that can be corrected with nutritional changes, sometimes it needs supplemental help, but without a doubt, if you've got blood sugar problems, there's a huge correlation between blood sugar dysregulation and neuropathy conditions. It'll be something we need to address. We'll take a look at thyroid function, because sometimes people with thyroid disorders have what are called autoimmune thyroid dysfunctions or autoimmune disorders, and that autoimmune system, not only could it be attacking the thyroid tissue, but it could be affecting and damaging the nervous system tissue, so we'll evaluate that. We'll look at your lipid profiles, because your lipid levels are a great indication of what's happening as far as what's going on with your blood sugar. And if you have blood sugar problems and you have high cholesterol, it means you're creating a lot of damage to the cells of the body and creating inflammation, and we need to identify it and take care of it. Now, I know you may already be taking a cholesterol medication, but unfortunately, even your cholesterol medication may be creating the problem you have. Cholesterol medications are notorious for causing joint pain, muscle pain, and nerve damage. So it could be one of the reasons why you have the neuropathy. So if you have high cholesterol, and your cholesterol medication may be at the root of your neuropathy, we're going to have to help you bring your cholesterol levels down naturally. Other things we're going to take a look at is C-reactive protein and homocysteine levels, which are markers for inflammation. And we're going to take a look at your CBC and differential. Your CBC is your red and white blood cell count, because what I said earlier was that your brain needs properly regulated glucose, and it needs oxygen for proper function. Well, your red blood cells carry oxygen to all parts of your body, and your nervous system is highly dependent on oxygen, as well as your muscles. If you don't have appropriate oxygen utilization, and you have a subclinical or a clinical anemia pattern, that needs to be addressed. Without increasing your oxygen carrying capacity, it will be near impossible to get you better. So we have to look at those things. Along with looking at your your red blood count, we'll look at your white blood count. Do you have a chronic infection that may be contributing to the problem? And if you do, there's testing that we'll need to do to evaluate that. Other tests that we may need to do are things like immune panels. Some people have autoimmune conditions which are attacking and creating damage to their nervous system. And if that's the case, we need to identify it. And the best way to identify it are immune panels. It's rare that I've ever seen these done by a primary care physician. They're just highly specialized tests that most people just don't use because there's not a medication at the other end of these tests. If the tests are positive, you don't give a medication. If the tests are positive, you need to make some lifestyle and nutritional changes to help modulate the immune system response. And it's a little too complicated to get into on this DVD, but just know that this is a test we may do. We may do other things like an adrenal stress index. And the adrenal stress index measures cortisol levels through the day. Cortisol is one of those chemicals that's toxic to the brain if you get too much of it released. And the best test that we've found to evaluate that is what is called an adrenal stress index. Sometimes I see people who have had blood tests done and say, hey, I've already had it done, I don't need to do it. Unfortunately, a blood test only gives you a snapshot in time. The adrenal stress index actually measures your cortisol levels 4 times through the day, because cortisol levels should fluctuate through the day, and we want to see that normal fluctuation pattern. Cortisol dysregulation or cortisol problems are highly associated with toxicity in the brain fog, creates confusion, fatigue, body fat storage, and is highly associated with blood sugar problems. So we'll be evaluating that. If there's a sensitivity problem, we need to identify that. Sometimes the foods you eat, your body's not reacting well to, and that's creating damage in the gut. And the person may have some underlying digestive problems that they know they have, or that they don't even know they have. And sensitivity problems like gluten sensitivity or soy or casein or egg can create inflammation, and that inflammation could also be damaging the nervous system. So I think you get the idea that some of the metabolic testing that we need to do may be pretty thorough. It's probably more thorough than anything you've had done so far. But it's by doing the tests that we do that we are able to help people when other people aren't, because we've just dug deeper. We're looking for a cause. In traditional medical care, most doctors are trained to look at the lab values. If the number's outside the lab value, we want to lower it. So if your blood sugar is high, we want to give you something to knock it down low. You have to change your diet. You have to change what's creating the high blood sugar, not just take a medication to lower it. It makes the numbers look pretty, but it may not make you any healthier. If your cholesterol levels are high, your cholesterol levels are typically high because of sugar problems. And so artificially lowering your cholesterol level doesn't change the dysfunction that's going on in your body. You still have a blood sugar problem. You may have a nicer or prettier looking cholesterol level, but it doesn't mean you're any healthier. So we've got to do some extensive metabolic tests. Not only is the metabolic testing really important, but we also need to do a thorough physical evaluation. We need to check you from the ground up, essentially. And so we'll need to check your feet, and we'll check muscle strength, sensory function, reflexes. And the sensory function will be to light touch, sharp touch, vibration. We need to check joint position sense. Are you aware of how your toes bend and move? Occasionally we'll get people in who I'll have them close their eyes and I'll move their toes, and they're not even aware of what direction it is. They can't feel them at all. If you can't feel your feet, it's going to make it so much more difficult for you to get around. You'll have to be looking down constantly to see where your feet are. We can change that, and we need to change that. But we have to do the test to evaluate how much damage there's there so that we know what we can do to improve it. So along with sensory testing of the lower extremity, we'll do the upper extremity. We'll do orthopedic tests to see if the pain or the problem is emanating from your lower back because you have a degenerative joint condition, you have spinal stenosis, you have arthritis. And so many times I'll have the patient come in and say, well, I don't think there's anything you can do because I have so much arthritis. that's just because you have arthritis, it doesn't mean that your nervous system can't get help.